All right, good afternoon and welcome everybody to the Go Wellness Practice Accelerator Challenge. This is your host of the day, Kate Archibald, and really excited to be hanging with this really cool crew here. And today we're gonna dive into some really cool stuff around some labs and assessments, and how you can utilize those things to convert your ROFs as well as just help your patients excel. Show some objective findings or some results of what you're doing. Before we dive into that, let's cover some announcements. We got the amazing Annie Asher with us today. Annie, what do we got coming up?
Yeah, so we have session one coming up February 25th and 26th. So if you're a signature member and have not registered yet, please do so. We only have about 5 seats left for live registration. Otherwise, you're going to be stuck with a virtual seat, which is still pretty cool because Shawnee makes it beautiful. But make sure you get registered right away. We're going to be breaking down all of our new Accelerate Wellness programs so that you really know how to implement each phase. Please make sure you get registered if you haven't already. If you are a non-signature member and are interested in attending, just shoot me a message in the chat box and I will give you all the details you need. And that's all I've got for today.
Awesome. Thank you, Annie. That was wonderful. So everybody get to session two or session one. Wow. February 25th, 26th. Make sure you're all set up for that. Well, let's dive into the content.
Sweet. Okay. Well, some exciting things to consider. We've launched this brand new process at Go Wellness that hopefully you guys are taking advantage of. And but yeah, I mean, what were some of your takeaways from that masterclass, Gabe?
I loved the like the questioning. So really drilling and asking the right no questions.
We talked about overcoming objections, about having like solid communication systems in place. But what we started with, and I still think it's like the foundational piece, is having massive amounts of conviction in your programs, just like really believing in what you're offering people. Because if you don't have that, then you're dead in the water. So that's a big piece too.
Yeah, and I would say the cherry on top was when we went through the 60 or the Accelerate Wellness program itself. Like and this is something Reagan spent thousands of hours just cultivating and creating more and more content and really organizing everything. We have multiple team members that have worked on it, and Annie did an amazing job designing it. But that document, I just think we leveled up our service by like tenfold from a clinician to patient standpoint, as well as what's even more exciting for us is that's something that we're able to deliver to you guys. So now I feel like we're delivering like night and day service for you guys. You have even more of a streamlined program, turnkey functional medicine system that you can literally just like take what we're doing, copy and paste it, and you're off to the races. That's
Yeah.
the exciting part about it, and it's getting fantastic, killer results, killer value, and just changing people's lives. So that's what's exciting.
Yeah, and it's scalable. It's easy to implement. So what I wanted to cover today is go through just some more how to cover objections and then how to use assessments in your ROF so that you have some objective data. And I know in the past we've talked about using like Apex has some great forms, and I like those. But there's a couple new ones that I'm going to share with you today that will allow you to provide essentially what would be medical necessity for people to jump into your programs, even if you have not ran labs. And so or if you've ran labs, the way we're using these assessments is you come back and you say, okay, well, let's look at your mitochondria health, or let's look at your liver function or your biliary status. And so we're going to cover that today. But first, let's jump into some of the big objections that are going to come up. Does insurance cover this? And so I just want to make sure we covered all the objections, because I remember there's a couple that were missing Friday when our time was up. And so, but does insurance cover this? So first of all, easiest way to talk about this is the fact that insurance is there to pay for you when you're sick. And maybe you get a wellness visit once a year, but really, I look at health insurance the same way I'd look at automobile insurance, and health insurance is no different. Yeah, I mean, it's like you don't want to use it unless you absolutely have to, which is, it's a smart thing to have it, but there's very little it does. Even though they get you'll get the nice label like, oh, it's preventative medicine or wellness care, but it's really not. And so, unfortunately, our programs, or not unfortunately, I just frame it like, okay, now remember, there's health expense and health investments. What we're trying to do is get you to a place where you can actually maximize the amount of savings by investing in your health. And so if you go through your ROF process very efficiently, you're going to find that your ability to get people enrolled will be it will be objection free. I mean, they'll just be like, yes, I want to get rocking on this. So I thought the same thing. I just was working with a patient, and she was so afraid to invest in her health, but she realized after about a year of dealing with her Hashimoto's on her own that she had to do something different. And so she finally found a way to afford the care. And in doing so, she came out and she was on, working part-time because she couldn't keep up, and got treatments. And within 3 months, her energy levels came back so much she was able to go back full-time. She picked up an extra side hustles, and she made $70,000 more because of her health. And so I can tell you, it's a proven fact that the healthier you are, the more productive you are, the more productive you are, the more opportunities you have to make more revenue and more money. So it's absolutely something that sometimes you have to invest in your health first before you can expect to get anything out of your body, because we all use our bodies and our brains to do our work and make money. Another response you can have is, have you ever considered what it would be like if you could add an extra 10 to 15 years onto your life that are healthy years, so that you have this concept called compressed morbidity, where you live to life to the fullest, and then when it's time to die, and that's, die young at an old age is what we say. But, imagine how valuable that would be to actually add another 10 years onto your life. Can you tell me what dollar figure you'd place on that? Yeah. Kate, how much would you pay if I said, hey, we can help you extend your life. We can create the environment where your biology can live a lot healthier for longer. Is that of interest to you?
Absolutely.
You crafting out your life is your job, but we're going to help you add some more life to your years and years to your life. So then the other response with finances is, with the money objection is, well, how much is it going to cost if we don't do anything about this right now? And I think this is the most powerful one. And that's what we're alluding to. Like, you're going to get a 3 times greater response with a no in your close cycle than you will with a yes. Like, well, don't you think this makes sense, Cade? Yeah, it does, but it feels like you're manipulating me again, right? So it's like, hey, what will it cost you? And not just, let's just forget about the quality of life, but how much is it going to cost you if your hypertension turns into full-blown heart disease or diabetes? You've got blood sugar dysregulation. And so reminding somebody how much it costs them for not taking action is actually one of the most powerful things you can do. Like, hey, I know it feels like a big investment right now, but I can tell you, you're going to save hundreds of thousands of dollars in the future by doing this program. And then you can prove it to them, because now the new research is showing that just by having heart disease, your indirect and direct costs are going to be $4.8 million. And if you look at the UK and the United States, the biggest chronic health disease that has crippled the healthcare system in both the UK and the United States is diabetes. So very expensive treatments. If you get these chronic diseases, it's not just out of your pocket, it's out of all of our pockets. So that's another way you can handle the money. Time, I think we covered time pretty well. Self-doubt, this is a big one. And Cade and I went through that in the beginning, where Cade's like, you probably talked yourself out of doing the program. So that's more that self-doubt case. And you're going to have to read each one of these. I'm anxious. What if I fail? What if I can't do this? I'm scared it won't work. I have anxiety around this decision. And remember that it's really important to separate your anxieties. When they have anxiety, a lot of us, we go to think that it's us, it's our program that they're anxious about. And maybe they don't see the value in it. And we want to go, or maybe they think it's too expensive, but really a lot of that anxiety, in probably 70% of the cases, just boils down to the fact that they have to make a decision. And it's a pretty big decision. So that is, that's really critical. Needing all the information first. If somebody needs all the information, all you've got to say is, okay, well, first of all, how open-minded are you to the idea that you might just be hesitating on making a decision versus needing more information? Because that's an important one, right, Cade? Because sometimes people are like, hey, I need more information, which really means they're just trying to kick the can down the road because they're anxious to have to actually make a decision. Has nothing to do with more information. It's like, what are you going to learn? The next thing is, I can give you all the data on peptides and all the detox processes we're going to take you through in the nutrition, but actually you're not going to know until you just get in the program and start experiencing it. Yeah. So are you open-minded to the idea that you might just be delaying making the decision?
And I think that is a beautiful question, because
if they say no, then they've got to argue, and they'll say, no, I'm actually super open-minded to it, but I need to know exactly what the peptides, what the safety is, and then you can show them, so either way, it's a win-win, because if they think about it, they're like, actually, there's not any more information I need. I think you're right. I'm just digging in my heels.
Procrastinating making an actual decision.
And then this is where it comes, Cade's favorite question is, what do we need to do to get you started today? So that's when it takes a lot of courage to really say, okay, what do we need to do to get you started today? Like I'm ready to move forward. You're ready. You're ready to move forward, but because you love the program, there's nothing you don't like about it. There's nothing I miss. You feel like I understood everything that's going on in your health. You've never worked in a program like this. You've never seen anything like this. This looks like exactly what you need. So the only hesitation right now is you just making up your mind and getting started today. So what's it going to take to get you started today? And then let them tell you, and then you say, okay, well, let's get this out of the way. Let's get you started today and figure out a payment plan that's going to work for you. But make sure the number one rule before you ever talk about the financial investment, you've got as many objections out of the way. So there should just be one objection only, which is, how am I going to afford this? And do you have a payment plan? That's all you want to get down to. But sometimes the counterfeit yeses show up. And when someone has an idea in their mind that maybe this is a $2,000 program, and when they realize it's a $15,000 program, it does make them question things deeper. So don't worry when they go deeper into the questioning, because they're just making sure they can extract the right value out of the money that they're investing. So.
Yeah.
Hey everybody, Reagan Archibald here. I hope you enjoyed the Go Wellness show and maybe learned a couple things you could apply to your practice. If you're a healthcare entrepreneur who wants to work in an academic think tank with like-minded humans who are just like you, looking to provide better service, better quality of care for your patients, reach us at info@gowellness.com, and we're happy to do a free practice analysis for you.